Number of coronavirus cases in China topping 20,000 now, with 425 deaths. The new type of deadly virus has prompted action to prevent its spread.
Bill Folsom spoke with health pros at Penrose St. Francis about what we should do locally and what we should know. He's here in studio to break it down. Bill.
Yeah, tens of thousands of cases in China. In the U.S. and Canada, there are only 15 cases, and those are mostly among people who have traveled to China. Well, our local disease prevention strategy is to work to cut off even a hint of the virus if it shows up and starts spreading. The coronavirus identified just a month back. It's new and spreading quickly in China. Another part of the world still has the attention of health leaders globally.
Absolutely, our radar goes up.
What the public really needs to know is we're a very low-risk area.
Anything is always possible in the emergency room setting, and we're always prepared for whatever walks through the door.
Symptoms for coronavirus are similar to the flu or RSV. It requires lab tests to determine which, if any, are making a patient sick. So the process of figuring it out starts with prevention steps at the hospital entrance.
And if you come in with a respiratory illness, we're going to give you a mask. We're going to ask you to wear that, and then we're going to ask some more questions to dive into the coronavirus aspect.
Right now, questions about travel are important.
So if you haven't been to China, you don't know anybody that's been to China, you don't have the coronavirus. You probably have a flu or the RSV.
Then there's Fort Carson's designation as a location for a coronavirus quarantine center.
Quarantine is only because they've been exposed. So none of them have it.
Fort Carson leaders say the quarantine area is also well away from the general population, an area where someone who may have been exposed can be monitored to make sure they don't show symptoms that could spread.
Beyond 14 days, you cannot pass it any longer.
So the greater concern locally remains the flu. It is here and it is spreading. Whether flu or coronavirus, the best prevention is regular hand washing, covering your mouth when you cough, and staying home when you're sick.